delight for me to see all of you here and to welcome you. I'm so glad you came out on this rather chilly evening. It's colder tonight than it was last night. But anyway, you made it here, and I'm delighted because we have a very special presentation for you. It's a joy for me to welcome Daniel and Michelle Jacobine, who are with us here. And they have a compelling story to tell. And also Dr. John Bruchalski, who is one of the most celebrated doctors, Catholic doctors that we have, who's also had a wonderful conversion in his life, but his claim to fame in my life is that he delivered one of my nieces. Yeah, isn't that great? You know? So, I run into women every now and then who said, yeah, Dr. Bruchalski delivered one of my kids too. So we're delighted to have him here. Of course, he's the founder of the Tech Clinic, now under the umbrella of Divine Mercy Care. And so without further ado, Dr. John Bruchalski.
So I'm 63 years of age. I've been a professional doctor that some of us, it's good to see so many friendly faces in the audience who I've worked with at Fair Oaks, as well as many people here who I've known as friends and acquaintances and patients over the years. So I've been a professional medical person for 40 years. 36 of those years, I've worked as a resident and now as a private practitioner. And I have constantly fought the underlying causes of infertility. That's what I wanted to do. I wanted to help build families. I wanted to bring happiness to patients. And I used all treatments and methods to solve this riddle of why women could not conceive children and continue a pregnancy. So for Truth in Advertising, for the first 6 years of my medical career, I encouraged and worked in the IVF, the premier IVF center in the United States at the Eastern Virginia School of Medicine. It was founded by the Jones doctors, husband and wife, Georgiana and Howard. They came from Hopkins. Now, we were a contraceptive research and development center. For any of you who know me, I also did abortions there in the first, second, and third trimester. But for reproductive health, not only were we a contraceptive research and development center, we were the home of the first test tube baby, Elizabeth Carr, in 1981. And it was there that I assisted in the operating room, and I sat around a table where we talked about hormones and the causes of infertility and how we could help women by building embryos, giving them an embryo. Now, for the last 34 years, after sort of coming to my senses in regard to the Catholic teaching on life and gynecology and what medicine as mercy really is, I came to realize that embryos were more than just loaves of bread that we made. They were part of the human family. And if you really believe that from the moment of fertilization, then you got to treat the illness in a different way. We're going to talk about that. So I want you to understand that everybody's welcome here, because this is a really tough topic, because I am also post-abortal. I'm also post-IVF. I'm also post-wasting and ending the lives of many embryos and many fetuses and many unborn children. And so this is something that I'm grateful for, Father. I'm so grateful for this opportunity to speak on this topic, or at least to create a conversation where we can dive deeper into how we treat infertility. So I want to cover the diseases that cause infertility, the process of IVF itself, the true reality and the scope of frozen extra embryos. over 1 million, at least in this country. And we really don't know that number very well. It's probably north of that. And then what is a better approach to infertility? And then just some general thoughts as we prepare for Advent. So the diseases that cause infertility are many. And back in the early days, when I first started, it was all about the diseases of the scars that developed from infections in the tube. Now, I'm not assuming that all of us are scientists, so it's just basic. The ovary releases the egg. There's a fallopian tube that connects the ovary to the womb or uterus. That's where fertilization occurs in a normally conceived, healthy child's early life or the beginning of pregnancy. And then it tumbles down the tube. It takes about 7 days to go from the ovary all the way into the uterus where it implants. And in medicine today, up until the 1960s, we all knew embryologically and scientifically that life began at fertilization when a sperm met an egg. And that early embryo, the electrical activity blocked all other entrances of sperm. And you began the life, not a potential human life, but a life with full human potential. Everything is there at that moment. My friend Jerome Lejeune, the founder of Down syndrome, said, in the beginning was the code, and the code is life, and the code is in life. He was paraphrasing John's prologue. It's how you look at genetics and its scientific reality. What about the soul, right? Well, when there's life, there's a soul. We're going to talk about that. But this whole idea that the Catholic Church, the soul is about, not so much about its relationship to the body, but its relationship to God. It's a whole different way of looking at science and life with respect and dignity for the human family. So first there's scars in the fallopian tube. Then there's ovulation disorders. So many of us who teach the fertility awareness-based methods, we absolutely ask patients to identify their fertile phase in their menstrual cycle. And it's done. This has been proven by the World Health Organization. You can do it to 95% effectiveness in the least educated countries. And so we begin to look at ovulation disorders. Then there's endometriosis, where there's tissue from inside the uterus, goes out the tube, lands in the abdominal cavity, and causes a chemical imbalance that helps promote infertility. Incredible pain. Infertility is absolutely a incredibly painful, difficult desire, the desire to have a family. And no one here poo-poos or makes that something that shouldn't be considered. It's truly a cross to bear. And then there's fibroids, those benign tumors of the uterus that can actually block implantation or be situated in a place that doesn't help fertility. Then we have prior surgery. If you've had your appendectomy, if you have your appendix taken out, the scar can also affect the tube in that case. Then you have the male factor, which occurs in about 3 out of 10 cases of infertility, where there's either a low number or poor motility in the sperm count. Then you have unexplained infertility, where you just don't know at the end. And we think that that's probably a large percentage, 30 to 40 to 50% of the time. And then you have all these genetic disorders, because remember, this overview of IVF, and we're going to talk about it, it initially was used to overcome the blockage in the tube. But now it's used all the time and for everything. You almost bypass, doctors often bypass looking at the disease and go directly to well, it's really efficient to make embryos, and we can do this for you, and this is how you can pay for it, and this is the effectiveness rate. And since the 1980s, we now have people coming to us 1 month, 2 months of trying to conceive a baby, and they immediately want results. And the impatience occurs, and I understand that in this world today. Those are very real issues. We'll talk about what IVF does and how the church would say, there's a better way to do that. Okay? So remember, because of age, at the older you get, the less quality eggs you have. We can measure that. And many of us here, I'm in menopause. There are many menopausal folks here. As we age, fertility decreases, as we all know. And obviously today, you can use IVF to have a child, even if you're not married, or if you're married to the same gender or sex. Back in the day at the in vitro center, when I was there at Jones's, they were incredibly Anglican. And they had really rules and regulations about who they would see and who they wouldn't see. And it was also there that we had the first divorce of an IVF couple, in which the dad did not want the embryos, the mother wanted the frozen embryos, and that case became the famous case in the mid-'80s and early '90s about, are these property or are they children? We'll talk about that here in a second. So let's kind of generally talk about IVF. It's a complex process. During in vitro fertilization, and this is going to be a general overview because we all have different views and all different experiences, but I just want to give you an overall view of IVF. Mature eggs are collected from the ovaries and fertilized with sperm in a lab. So we give the mom, we usually shut off her fertility, then give her medications to stimulate her ovary to make many eggs, because the price of IVF is pretty significant. And the success rate for IVF is anywhere from 30 to 80%, depending on the variables used. But because it's so expensive, and because it's so invasive, and because you have to take chemicals and do surgeries with invasive procedures, you want to collect as many eggs as you can from the woman. That's the stimulated cycle. So in order to build more embryos than needed, right? That's where these millions of embryos in storage and the whole idea of embryo adoption or snowflake adoptions have come from. Because they're everywhere. And they're just sitting there. We'll talk about that here in a minute. Now, once you place one or more fertilized eggs, because that's the phrase we use. Now remember, when you talk about this, you're going to hear words that are said, and the meaning behind those words are not always directly spoken to you, because there is a natural human bond between mother and child. Even at the embryo level, because of the chemicals being released and because of our own collective human nature of the bond between mom and her child. And so what happens is that each cycle takes about 2 to 3 weeks. Once you place several embryos in the uterus, and then you do monitoring of hormones and ultrasounds to see how many took. So there's a large wastage percentage. Now, over the last 50 years, the science has tried to get to single embryo transfer because we've realized that the more embryos you put in, the higher orders of multiples you may get. Twins, triplets. What does OBGYN do? We offer selective reduction. Can you imagine if there's twins or triplets or quads or quints, our suggestion is often you can selectively reduce or abort 2 or 3 of those down to a singleton or a twin, depending on what you want. Can you imagine? And I've seen it too numerous to count, and I did it. You have a woman who desires to have a family, desires to have a child. You finally get her 3 or 4 embryos alive in her uterus, and because of the high risk of that pregnancy, statistically, it becomes very efficient and very, I'm trying to think of the word, very utilitarian, that if you end the life of 2, the other 2 or 1 will thrive. That emotional trauma is significant. And one of the reasons why I changed my own heart on this issue is that I found moms, women in my practice, who back in residency went through the process, went through the freezing, and then they began to have second thoughts about the left behind, those children of hers, those embryos that were left behind in the frozen concentration can of the liquid nitrogen canisters that we use to preserve embryos. And so what happens is that all these steps, the harvesting of the eggs, the stimulation of the ovary, the fertilization outside the body, then quantifying that and qualitatively evaluating this. Is this a good embryo? Is it a mature embryo? Is it fit to go back inside the mother? There becomes this whole, is this child worth continuing its life? Is this a human person that deserves to complete its life? And so here we are now with this process. And it's one of the areas, and the Catholic Church says there's no really good answer anymore for frozen embryos. Why? Because there's many more out there than we need. The only solutions are for the mom to, or for someone to either adopt or implant it. Secondly, let it go on to scientific research, and then it will die, or allow it to thaw out and let it die, or try to put it back in the mother to complete her family. These are not really good options, and the church has found it ethically impossible anymore. What's the right answer? Do you baptize them? Do you not baptize? They are members of the human family based on science and faith. What do we do? It's a very scary point when the Catholic Church says there's no really good answer anymore to this problem, because we've gone down a rabbit hole that has really presented us with this conundrum. Yes, Father?
I was just going to say, when you said there's really no good answer because all of them are ethically problematic.
Bingo.
That's the point to make.
That's the whole point to make, is that every single one of these embryos, what do you do with them?
And you don't have an answer.
And you don't have an answer. So, once again, we have this issue of the excess and the excess of embryos, and Father has drilled down to the important factor, because the reality becomes, and this is what has happened in our office. We're going to talk here in a moment about how rather than waste these embryos and use the human body as a mechanistic, materialistic, like fixing a car or building a loaf of bread. We can get you good quality. We've gone not only to selective reduction, but we can also have other people's sperm, other people's eggs, brought into this equation, we can then have gestators, where a friend of yours or a sister of yours or a stranger can bring this new life within them through a contract, and then supposedly at the end of this process, give it back. After she delivers, give it back to you as your child. This is where we are today. And the challenge with the mental health issues of this entire process is now coming home in our data collection. So one of the questions that we ask, so we approach the problem of infertility in a different way. We'll talk about that in a minute. But the question that we constantly remind our patients is that, okay, I understand you want to go on to IVF. Before you go to IVF, there's one question that you and your husband need to ask. And you have to come to an agreement in, are the embryos that my doctor and his team are going to make, are they my children or are they my property? That is the most important question. Do you love them like a child, or do you own them like property? Because this is the question that I see, and many of us see in the healthcare industry, when women come back to us who have gone through IVF, the depression and the despair and the sadness and the anxiety. Oh my God, did I leave my children in limbo? The desire of motherhood and the biology underlying that, the proteins and the enzymes, from the moment of fertilization is immense. And I have found this to be one of the most commonly said problems with the whole process of IVF. Are they loved or are they owned? Because we have used language like a fertilized egg rather than an embryo. In other literature, we say it's a fetus rather than your unborn child. We constantly try to distance people in language and in practicalities with efficiency to kind of break that bond so you can move on with your life. Okay?
It's
Yes,
so
Father.
depersonalized.
What?
It's depersonalized.
So we absolutely believe, Father, that health is relational. Health is sacrificially, at its heart, relational. You can go anywhere in the country, anywhere, Rio Grande, outside of Boston, up to the Oregon forests. If a man my age, 63-year-old man, obese, hypertensive, diabetic, cancer, if I have caring people around me who sacrificially love me, my morbidity and mortality is better than those who don't. Health is relational. And this is how I'm going to lead into, for the next few minutes, how the Catholic Church encourages us to treat infertility. I'm a man. I don't identify as a woman tonight, even though I am a gynecologist. You, all you women, you taught me gynecology. I grew up trying to be the best dang OBGYN I could be. And I was born in 1960. And in the 70s and 80s, I was surrounded by people who believed and convinced me that class 1 carcinogens, hormonal contraceptives, sterilization, ad nauseum, all the things that the world says is good reproductive health was the best for women. And I wanted it. So I went to a really great institution because I wanted to be the best I could be. I did abortions. I helped them unite sperm and egg in petri dishes. I did ultrasounds to do laparoscopic or ultrasonographic removal of, we called it sucking eggs back in the day. We clapped when the quality of the embryo or the quality of the egg was good. Quality? Human life? You know, my cousin Mike had Down syndrome. He asked me during that time, hey, am I an endangered species? I was there, but thanks to my mom praying for me and people like you praying for people like me, meeting people like Marcia who teaches you how to listen with the ears of the heart to women. What are their needs? And then one ear to the Lord. Lord, what do you ask of me? I came to my senses about the Catholic Church teaching. It's amazingly merciful, and it's amazingly effective, and it's amazingly encouraging because it teaches us to lean into disease and suffering. Because the Lord came to us at the end of Advent from an embryo and a zygote and a fetus and a babe. And you lean into the suffering and the craziness and the sacrifice and the disease. So not only is health relational in Catholic healthcare, medicine is an act of mercy, like housing the homeless, clothing the naked, adopting the least. You begin to care about who are the least, who are the abandoned. Frozen embryos meet most of those criteria, whether we like it or not. And I can't throw stones because, once again, I have metastatic cancer. I'm infertile. I suffered infertility. And I remember them asking Carol and I, hey, do you want to freeze some sperm? We can just do IVF later on. I thought about it. And this is after my conversion. Why? Because I'm human. Wow. Could I? Should I? Daddy? No, it's okay. I'm okay. Thanks so much for offering, Doc, but I'm good. And it was because of people like you in this diocese, in fact. So, how do we treat infertility? Just like the women in this audience taught me, you listen to the patient. You don't put a Band-Aid on something. IVF bypasses the disease and goes directly to creating embryos. That's at the core of IVF. And it's that in and of itself which makes it problematic, because it's treating a human that should be welcomed as something wanted and constructed rather than loved and allowed. There's also an emphasis on obedience to what you believe in. Science tells us it's an individual human life. Now, science tells us we can do a lot of things to get you to this point. You got to walk through it. You got to talk. You got to talk to people. You got to talk to Father. You got to talk to your friends. You have to make an informed conscience. And so what we do is you listen to the patient, and they're telling you symptoms of the fibroid, of the endometriosis, of the disease, of the difficulties, of the frustration, of the despair, of the sexual impotence. These are all real diseases that you listen to the patient. Now, we all heard about what we used to call NFP. Well, it's now fertility awareness-based methods. And there's a FACS organization that is now teaching this on medical school campuses because the science has finally caught up. And by teaching you the language of your body, we actually make the woman body literate. It's what the young folks that I've been talking to tonight, it's what you've been asking for. Don't just give me a pill and push me on. Can't you figure out why I'm doing this? Is it polycystic ovaries? Is it endometriosis? By finding out the diagnosis and treating the underlying cause, you may have heard of NAPRO technology or the fertility awareness-based methods. We teach you the language of your body, and you begin to tell us what's the first phase, the second phase, the third phase. We then understand, you extrapolate that to figure out, what are your hormones doing? Estradiol, progesterone. What is ovulation? Do you measure it throughout the cycle? We can do that. So we use the foundation of the cycle to get with our ears and heart and brain to the diagnosis underlying infertility. And it's revolutionary because you're actually listening to the patient and you're addressing the cause of her infertility. Yes, sir?
And there's no substitute for intercourse.
And there is no substitute for intercourse.
That's the key.
And I would say that, Father, I have seen many patients come out, even those who've achieved a child through artificial reproductive technology. You know, the title tonight in my head was The Art of Accompaniment with People Who've Done Art, Artificial Reproductive Technology. There have been two complaints. One is, it's so impersonal and the embryos are isolated from us. There's no relationship. And then the women, and usually the women, because I see them, they're the ones that then say, it's like being treated like a machine. Even with the success of the child. And then you add to that the fear of the anxiety of, oh my God, what am I going to do with my extra frozen embryos? So I'm going to finish my section of the talk here tonight with some Advent admonitions before I pass it over to my friends here. Potential humans or humans with potential, the capacity is already there, and active potential is already there according to the biochemistry of life. What makes human beings valuable? Are they children or are they property? That's the question, because if they're children and they're members of the human family, they're part of the Our Father. And I'm not going to end here with any philosophy or ethics or science, because we are Catholics and it is Advent. And it's about this relationship that Father pointed out so eloquently between doctor and patient, practitioner and patient, patient and doctor and God, and them and their children. The significance of embryos lies not in the powers or capacities they possess, but in relationship to their creator first, and secondly, in relationship to their parents. The significance of embryos lies not in its power capacities, but in its relationship to God, and secondly, in its relationship to parents. The strongest argument for an alternative approach to infertility comes from Christ himself. Jesus, though we understand what it is, he understood what it meant to be human. He began his life as an embryo in the womb of Mary during a crisis-wanted pregnancy. Though he was in the form of God, he humbled himself and found himself in the human form. Once again, Matthew 25:40 talks about the least of these. What I'm going to ask tonight is that our preparation on praying about this issue and to help us talk to our friends and family about it in a way that makes a difference. The incarnation, or Christmas Day, doesn't contradict the doctrine of creation, biology, or medicine, but absolutely includes them. As someone said, every child in the womb and in the nitrogen concentration camps have been brothered by the Lord Jesus. And so tonight, I just want to leave us with these prayers, and we can finish up with these prayers after we get the presentation on adoption. So thank you very much.
We can see in our broken culture that there are societal causes for infertility. So what would you say to the woman, because we are built for motherhood, be it spiritual or physical, the woman who has that deep yearning in her heart, but no man, because of the broken society, and she is a woman alone, but wants to be a mother. So she has this really important need that is given her by God, this desire to share her life and her love. But she's a woman alone, and so society says she can go through IVF. You don't actually need them. How would you counsel her?
And the way that we do it in our office at Tepeyac OBGYN, and when you talk about Fair Oaks, I think we're moving our practice, our deliveries over to Stone Springs. So we'll see if that's, we're encouraged by that. But the social ideas today of when you divorce love from life and life from love, you end up with a cascade of broken living of lies, so to speak. Now, when you find someone like this, you have to engage them that children demand parents, not just one or the other, but both, because it's complementary. It's the way we've been doing this for centuries. And it's built into us because of, now I understand why they would want to do it on their own. The broken relationships in the world today are everywhere. And people are like the walking wounded. So what we would do in that case, we would present the issue of talk to her about her relationships as part of her medical history, and to encourage that people can go and do IVF as a single person. Because once again, no one's going to stop you from that. But think about your own growing up, because in that particular case, that person may have had a really challenging childhood with a very difficult father, oftentimes we find. And you begin to just listen and let her explain herself. And she will, in our case, doing this hundreds of times, if not many hundreds of times, they talk about the pain of growing up in a broken family. And you begin the process of accompanying them at that moment and planting the seeds, because I'm not responsible for that person, I'm responsible to that person. And you begin to talk about the breakdown of the family, as well as the many societal issues that come with a broken family. Now, once again, she's going to do as her heart moves her. But if you plant the seeds, what we have found in all of these areas, whether it's premarital sex or divorce or a 50-year-old going after a 20-year-old man because it's something exciting, you plant the seeds and then you welcome them back. And that's the beautiful part about the type of medicine that the church provides. Not only do you look at hormones and the stress and those signs of your body, like when you're fertile, the irregular cycles, the irregular cycles that are often psychologically caused. And you can actually talk to her about the body-soul connection. But to talk to her that children deserve parents, plural, both. The man provides equal to the woman, but very different. And that's what society has been built on for millennia. And so that's how we do it. We plant the seeds when we can't convince them, because remember, it's not an argument. And their experience may be totally different than yours. But you kind of meet them where they're at and walk with them through it. And they often keep asking. And you begin to, watch this person grow in wisdom and grace, and give her something to ponder about in her heart. But that's a huge question, and it's a big deal today. We see it everywhere.
Can I not?
Yeah, sure. Go right ahead. Sure.
I don't have that much experience to speak to this, but I was just having a conversation with someone who is involved in the research and was just telling me what staggering statistics there are of everybody who's in prison. It's the majority is fatherless children. And so this societal crisis we're going through, basically, of fatherless children, and just how that impacts everything. It impacts the learning, the relationships in the future, just everything. And so I think that that's really hard, because again, for us, it was, well, we want a baby and we want that baby. And so if it's the best, it may be good for us, but was it going to be good for that baby if I couldn't take care of them and he had to do everything on his own? I would also say, as a mom of two little ones, I have no idea how single parents do it. I have no idea. And that was exactly what Crystal was experiencing. And that's why she chose this path for Mila, because she had a 1-year-old, and she said she worked full time. The 1-year-old had to be in daycare full time. So she has to then pay for the daycare full time. So then if he gets sick, she can't work, so she doesn't get paid. So then they don't have food. And if he gets sick at night, they end up in urgent care all night. And she ends up so exhausted, she can't do her job well the next day. There's no one to help you. And we're seeing a society that's growing up this way. And so it's just, it's something we need to figure out what to do about it. But that would be my thought.
Yes.
Does babies conceived from IVF have any problems in the future?
Yes, they have a higher incidence of limb, arms, and leg issues. They also have a higher risk of miscarriage. And we think that's because of the chemical support that's needed to help allow the child to hang on to the uterine lining. Those are the two biggest. However, there's also a higher risk of mental health issues. And this is something that we have seen in our office now multiple times, close to 10 times over the last 20 years, is that a young student from one of the universities comes in, and at the end of her annual exam, she's in college at the time, and she's just there for her regular checkup. She'll ask at the end of her visit, is it normal for her to think that her mother is going to kill her? So this is a young lady, say your age, 17, 18, 19, comes in at the end of a regular visit, says, is it normal for me to think my parents, or my mother especially? Well, what do you mean by that? And this is the story they've told.
Another aspect of this that comes up in the literature every now and then is that someone who's been donor conceived, right, which is kind of, through IVF or maybe surrogacy, whatever, but, you know, they grow up and they had no idea, their parents didn't tell them. Like the parents didn't tell them that they were conceived through IVF. And so they grow up in a family thinking that the father is their father, and they find out he's not. And so what happens is, and this has been in the literature recently, even highlighted in the Wall Street Journal, is that then the person feels disconnected from personal origin.
Correct.
And this goes into, you know, another societal problem. So then what happens is the child, now the adult, wants to find the father and then have to backtrack through the records of how this all took place. And sometimes the father doesn't want to have anything to do with the child. So then there becomes a series of rejection. And then on the other hand, sometimes relationships do develop. But this is all very problematic on many, many different levels. And this is what is going to continue in society, because as the testimony here from both sides shows, there's enormous profit motive for this. And it's all legal, right? But it is morally problematic. It is, and that's the key thing I want to leave with you all here, right? It violates or frustrates God's plan for the human family, God's plan for the human person. And this is what we have to promote and let people know, you know, the people in your circles or whatever, you know, some people are easily attracted to this for a very strong reason. They want to have a child. A very strong reason, right? But we need to reach out to them. We have to listen to them, but we have to, you know, engage them on this level. So I wanted to bring that up.
Yeah, in this case that I'm talking about, not only was the father a donor and who didn't want anything to do with the young lady, but she found out that she was conceived at our infertility center 19 years earlier, and that there were 15 embryos left frozen. And she felt as if she was the survivor of a Titanic accident. Mom, did you love me because I made it? I survived? Because she was learning in her biology class about reproductive health. And they were going through IVF. The case that I'm remembering is from George Mason. And this idea that if I wasn't perfect, or you would leave me behind, I have questions. Even though the mother tried to do it out of pure love. Honey, I told you I did everything I could to conceive you. I did everything, but the reality at the heart level, young lady, was absolutely different. So I absolutely agree with Father. Anything else? I think Father said till 9 o'clock. There's just a few more minutes left. I want to thank you so much for being here tonight and spending your time with us. The note that I want to leave you is that when you begin to look at the whole human person, body, soul, and spirit, as a woman in gynecology, you begin to realize that their body speaks a language that not only can you identify hormones and surgical issues that you can treat. You always hate the disease, but you love the patient. That's the bottom line. And you don't get rid of diseases by getting rid of patients with those diseases. And you can do an excellent workup with NAPRO technology to treat the underlying symptoms in many of the cases. And when it doesn't work, I think that there's an incredible option for the adoption piece that you heard tonight. And reach out to any one of us here. And like I said, it's really wonderful to be here with Father Killian when a doctor of the soul and a practitioner of the body and our patients and parishioners are all on the same, we may not totally agree, and like it was said, we grow into this. It's a process. You don't come at it with absolute answers. And it's live at the Improv, as they spoke about so eloquently. And yet, with good prayer and good support and good intercession and good, merciful teaching from our Catholic Church, we can get through these issues in such a way that it's healthy and whole, holistic as well as holy.